There's a big change on how multiple sclerosis is diagnosed now. And if you've ever felt stuck waiting for a confirmation, this could possibly help. So in 2024, the McDonald criteria, which is a criteria that doctors use to help diagnose multiple sclerosis, was updated. This was mentioned in the Lancet just this month that this is to help people get diagnosed quicker. One of the biggest updates is they have taken out the DIT, the dissemination in time factor. What this means, that means that you don't necessarily have to wait for a second relapse or changes in your MRI before a doctor will diagnose you with multiple sclerosis. If enough evidence is there, you can get the diagnosis. Then another one that I always thought was a little interesting, it wasn't a part of it, but the optic nerve is now a part of one of the places they will look for with multiple sclerosis. Whenever you are getting diagnosed, there is dissemination in space, meaning they're looking for lesions in different parts of your central nervous system. Your optic nerve is now part of that. So visual issues, there are tests that they run for those types of things. Those now count more than they used to. There are also some new biomarkers. Lab things like kappa-free light chains can be used. Before, oligoclonal bands were pretty standard, but now they have the flexibility to potentially catch things quicker. There's a thing called RIS, which is radiologically isolated syndrome. That is when they find lesions in an MRI, but the patient doesn't actually have symptoms yet. And now, under certain circumstances, these people can get diagnosed, meaning they are going to potentially be diagnosed and start treatment before they ever have symptoms appear. Also, some guidelines for children, older adults, or other people that have overlapping risk, meaning vascular disease, etc. Basically distinguishing the fact that MS can be a little trickier to diagnose or see with those types of people. Even with an update though, you're more than likely going to have to rule out other conditions, just because even though the criteria is broader, that does not mean it's an automatic diagnosis. But what this can mean is less waiting, fewer unknowns, less time spending with no answers. If you've ever felt misled or you felt like you have everything but the actual diagnosis, this could potentially help. I know for myself, I potentially could have been diagnosed sooner because we were always waiting to see. As always, if you have MS or you love somebody that has MS, drop a heart in the comment. And maybe share this with somebody. Or if you're trying to get diagnosed, you may ask your doctor, does this new criteria apply to you? I just thought this was really cool news, and I feel like it is a big push in dealing with multiple sclerosis.